Have you ever woken up the day after retiring and felt something you weren't expecting? You feel proud, maybe even excited, but then a little thought creeps into your mind. How am I supposed to handle my health insurance until I'm 65? That question alone can turn a relaxing morning into a stressful one. And if you've been feeling that way lately, please know this: you are not alone. Many retirees in the United States go through the same moment of confusion and worry. You didn't do anything wrong. This is simply part of the transition into this new chapter of life. And today, we're going to walk through it together, slowly, clearly, and without confusion. Welcome to the Retiree's Guide. This channel was created for people just like you, people who have worked hard, taken care of families, and carried responsibility for decades. Now you finally have the chance to focus on yourself. But let's be honest, retirement comes with questions no one prepared you for. Health insurance is one of the biggest ones. Before we get started, take a moment to like this video, subscribe, and turn on notifications so you don't miss what's coming next. We're building a supportive place for retirees, where things are explained calmly and clearly, and where you never feel talked down to. You deserve that. Now, let's take a breath and start with something simple. Many retirees tell me the same thing. Retirement was exciting until I realized I no longer had my job's health insurance. It's a common experience. You finish your last day at work, you get the hugs, the cake, the congratulations, and then the next day, it hits you. What now? It's completely normal to feel uncertain. Health insurance can feel overwhelming, especially when your employer handled it for so many years. But here is the good news. You have options. More options than most people realize. And many of these choices are straightforward and affordable. Let's start with one of the most helpful options for retirees under 65, the Marketplace, also known as healthcare.gov. This is a strong option for one simple reason. Your cost is based on your income, not your age. When you retire, your income usually drops. Maybe you're living off savings, Social Security, a part-time job, or a small pension. Because of that, Marketplace plans often become surprisingly affordable. The Marketplace also requires all its plans to cover important things, like pre-existing conditions, prescription drugs, hospital visits, and preventative care. You won't get denied for previous health issues. Everything is laid out clearly, and you can easily compare plans online. For many retirees, this becomes the most balanced choice: good coverage, fair prices, and simple to understand. Another option you may be familiar with is COBRA. COBRA lets you stay on your employer's health insurance for up to 18 months after you retire. The best part is that nothing changes. Your doctors stay the same, your coverage stays the same, and you don't have to learn a new system. The downside is the cost. When you were working, your employer paid a large portion of your monthly premium. Under COBRA, you pay the whole thing yourself. This can be pricey, but it offers comfort and stability, especially if you're only 1 or 2 years away from turning 65, or if you're in the middle of medical treatments and don't want to switch doctors. For some retirees, sticking with what they know is worth the higher cost. Private health insurance is another path. These are plans sold directly by insurance companies. They might provide more flexibility or additional features you can customize. Some retirees like private insurance because it offers wider doctor networks or different coverage options. However, private plans can be more expensive, and the details vary from one company to another. If you explore this option, always ask clear questions about the monthly premium, deductible, out-of-pocket maximum, and prescription coverage. Private plans work best for people who want more choice and can handle a slightly larger budget. Another possibility is health sharing programs. These are not traditional insurance. Instead, they are groups where members agree to share each other's medical costs. They can be cheaper and simpler, but they come with risks. They don't have to follow insurance laws. They can deny coverage. They may not pay for pre-existing conditions. They also aren't legally required to pay claims at all. These programs can work if you are very healthy and rarely need medical care, but they're usually not the safest long-term option for retirees. Now, here's something many people don't know. If your income drops low enough after retirement, you might qualify for Medicaid. Medicaid offers free or low-cost coverage that includes doctor visits, hospital care, and prescriptions. Some retirees hesitate because they feel embarrassed or think Medicaid isn't for them. But here's the truth. You have paid taxes your entire life. Medicaid exists to help people during transitions, difficult times, or periods of lower income. There is absolutely no shame in using support that you've earned through decades of work. There's another path some retirees take, working part-time for benefits. Stores like Costco, Home Depot, Lowe's, hospitals, schools, and others offer health insurance even to part-time employees. Some retirees choose this not for the paycheck, but for the structure, social interaction, and the sense of purpose it brings. It keeps you active, connected, and gives you access to solid insurance. It's a win-win for many people. Now, let's pause for a second because I want to say something that matters. You are not too old, you are not late, you are not behind. You are simply entering a new phase of life, one with more freedom and more control. Choosing healthcare isn't about fear, it's about planning for the peaceful, joyful years ahead. And you're doing the right thing by learning your options. While today's video is about health insurance, your life in retirement is much bigger than that. On this channel, we talk about all the things that help you build a healthy, happy, and secure retired life. We'll talk about health and wellness, the kinds of activities that keep you strong without overworking your body. Gentle exercise, smart nutrition, simple habits for energy and mobility. We'll talk about financial security, how to manage savings, Social Security, and avoid common risks like scams or overspending. We'll talk about purpose, because retirement isn't just about stopping work. It's about discovering what makes you excited now. Hobbies, travel, volunteering, spending time with grandchildren, learning new skills. It's a chance to rediscover yourself. We'll talk about simple ways to earn extra income from home. Only real methods that are safe and senior-friendly. And most importantly, we'll talk about emotional well-being. Retirement can feel lonely sometimes, even if you don't tell anyone. It's normal, but you're not meant to go through that alone. This channel is here to help you stay connected, purposeful, and mentally strong. If you want a place where things are explained with respect, where you feel understood, where you never feel rushed or confused, then go ahead and like this video, subscribe to the channel, and turn on notifications. You'll be joining a community that truly cares about you. As we close, I want to leave you with this idea. Retirement is not the end of your story. It's the beginning of a brand new chapter, one that you have earned. You have wisdom, strength, and experience that only a lifetime can teach you. Choosing the right health insurance is just one step in creating a peaceful, secure retirement. And you don't have to figure any of this out alone. You're part of the Retiree's Guide now. We'll walk every step of this journey with you, from healthcare to finances to purpose to happiness. Thank you for being here today, and I'll see you in the next video, my friend.